Good morning with everyone present. Today I'm going to present my work titled Vulnerability Analysis of Anemia in Peruvian Departments, a temporal comparison using the technique of AHP. So first, I want to talk about the problem about anemia in Peru. Anemia is a condition in which the number of red blood cells are very low in comparison to the other cells. It mainly affects women that are pregnant and children that are under 6 years old. And in Peru, the national average prevalence in meanings of the total cases reported of anemia in children under 35 months during 2022 was the 42.2% of the total population. This number increased from 2021 and also comparison with 2029. Mm, The main hypothesis that was discussed about this number increasing was the impact of COVID 2000, the pandemic. Also, the total anemia reported at the end of 2022, even though it's less than the prevalence at 33.6%, doesn't indicate something good is happening because these numbers were increasing in the most uh, departments who are with a high risk to come to anemia. Um, These consequences usually are not only physical, but also associated to the learning experience and learning rate of the different students. This deficiency cause complications, and if it's not treated, it has a long impact in our society. It's usually associated with low growth, delayed psychomotor development, and cognitive development, and sometimes also with the vocal ability and motor coordination. And in the case of during the pregnancy, is associated with an increased maternal and infant morbidity and mortality. So, some key concepts that are needed to continue in the presentation are first the vulnerability, is the possibility of harm in this case of contracting anemia, and also limitations and to the mortal condition of the human being. And if we're talking about threat, is the potential danger or harmful event that can exploit a vulnerability. In this case, we can talk about natural factors maybe, or even the pandemic. So we have seen that departments that are very vulnerable to certain conditions were facing the threat at a different level from low vulnerability departments. And when we talk about risk, is the potential loss or damage associated with a specific threat that, well, in this case could be uh, education absence, low growth, and the others that have been mentioned. And in the case of prevalence, as I said already, is the proportion of population who had a specific characteristic, in this case anemia, during 2002, 22 or 2029, that are the two main points of time that we are evaluating in this study. So, I'm not going to spend too much in AHP, but we use this technique, this method, because it's really low cost and allows us to basically show in a mathematical way what are the criteria we're using to classify each department, the priority of each department, and also show what are the most important things to us to classify this way, and also don't have that counter argument of, oh, you're not using correctly the importance of this criteria or this other criteria. And talking about criteria, the criteria that we use are four variables. The first one that is the most important according to the literature is the access to safe water supply, because this is one main characteristic that some children could eat food in a not clean food, eat with their hands dirty, that leads to stom for the digestive system complications, such as vomit or diarrhea, and well, don't
Also,
have the
okay.
system to be able to, sorry, to basically take advantage of the food they are taking. The second criteria, which is different from the work that was presented in another conference, is the prenatal care by health professionals. We're using these criteria as the second most important because having the mother taking care of herself and also her baby leads to less complications during birth that can cause anemia or other conditions. Third, we're using a criteria that's not actually in the moment, but also talking about what happened with the population, that in this case are 15 years of age, that probably if the if the department has had a lot of prevalence of anemia, this education is affected. Uh, this effect has been also studied in different studies, so we are keeping that as one of the third most important criteria. And lastly is the level of poverty by in the group departments. So some results that after applying the HP and the criteria, basically we have Cajamarca as the most high risk department for prevalence of anemia with almost 0.09. We are evaluating basically 25 departments, so the numbers are not that high comparing to if we use only 4 departments. In this table, we are showing only the most key or most highlighted ones. In the case of the first 5 ones, were also similar to the 5 with most prevalence of anemia. I can pass this just a little second. Basically, the prevalence almost in the 6 first, the prevalence is more than 50%. So definitely is happening something here. And in the case of Cusco and Ayacucho, we basically we put them here because Cusco actually had a high uh, from 2029 and 2022, the department basically had a step back from the work that they were doing. And the case of Ayacucho was the contrary. It's one of the only departments that actually went down from 2029. Basically, we used the same criteria. We took a photo of the priority in 2029 and the photo in 2022, and we could compare more easily and see which departments could have done something different to prevent anemia, maybe campaigns. We also compare these with the number reported for prevalence. So, what were the key factors that for this to happen? The main biggest key factor was actually that during 2017 to 2021, there were a national plan for reduction of control of maternal and child anemia and chronic child malnutrition, which basically consist in campaigns to teach about anemia, consisted of different benefit plans, food plans to give to the population, and also there were several hospitals that were opening in these departments. However, during 2022 and 2023, there were not such plans similar to this. Most of the resources were redirected to attend high care, high risk patients that were relation to COVID-19. But even though with all of that, we have seen like Ayacucho that having grown the vulnerability. This is mainly because people still lack of access to quality water services. not only safe water to consume, but also water to use for different things like cleaning dishes, cleaning food that Ayacucho did improve during those years. And lastly, we can talk about the infrastructure and equipment gaps in the health sector. That is one of the criteria that could be analyzed in the future. So we have that. And just for concluding the presentation, the integration of temporal comparisons can show critical shifts in anemia vulnerability, enable policymakers to identify these key points to see what a region has done different to intervene and may replicate in some places that are similar. And the AHP allows this to happen because it doesn't need a lot of data, just the minimum necessary, and can take photos in time to compare very easily and reduce the all the data of basically 25 departments in just one image or one table. So thank you for your attention. Did you have any questions?
Thank you, Benjamin. Thank you, Benjamin. Have any question
I, I,
of this
I
project?
do have a question, but then if there is somebody who has a question, I don't want to be the first.
Okay. Mm, I have I have some question. A good comparison before COVID, no? Anemia before COVID, I think, and after COVID, no. But you are considered with which are criteria of social feeding programs in
Uh,
your
in this study, we
criteria.
haven't used programs that benefit like Caliwarma. We have in the previous work that we have presented in another conference, we indeed
Mhm.
use that criteria. However, it has very low impact in the AHP ranking and also in reality. There were 3, 4 studies that evaluate what the impact, and basically the three of them said the impact is very, very low. It's only affecting a uh, very a small part of the population that is not enough to have a meaningful impact in the prevalence or total anemia of the children under 35 months.
Okay, thank you, Benjamin. Okay.
Uh,
Thank you, Benjamin.
yeah, but my let's say it's more a clarification. Just want to make sure. So you have determined that there are these four key criteria that really are the most important indicators of anemia specific in a specific area. Is that right?
If I'm not understanding the question, according to what we have researched, these four has had have a high impact on the prevalence and of anemia.
Okay, so your hierarchy is basically these four criteria. And have they been pairwise compared to weight them? And if so, who's done the comparison?
Oh, every single one in one study, no, but in different studies they have tried to understand this. And in the case of Muñoz del Carpio, during this year, they made a study in late prenatal care. That's basically one of the two most important that try to sorry, Graham, no Muñoz del Carpio. Graham in 2024. It was not here in Peru, but in the study they say, yeah, it's very important to take care of the mother and that the mother cares of herself because it leads to several complications. Like if she does not eat right, that could be because of the diet or because she didn't follow the indication of the doctor, the children can be born with very high, with low uh, peso, peso. I'm
Wait,
sorry, I forgot the word to
wait.
peso.
Wait,
Weight, yeah, weight. Um, in the case of uh, iron deficiency and the school that the population under 15 was in this case studied by Chung in 2026. And we have also the study of Lorena in 2022, which talks about the uh, how it is dynamic system. Like uh, the department has a poverty level of, let's say, very high. This will affect the population. The population could have anemia, and this can lead to very low school attending, and this leads to a population who is not ready to make changes in the active population that provides to the department, and this still leads to not taking the department out of the poverty level that they are. And so this fits itself in basically a dynamic system.
Yeah, this the four indicators, the values you obtain from the National Institute of Statistics, right?
The data for comparing each of them, yeah, there is the CIRTOT, the Regional Information System, which is a little bit low, but since we don't need that much information, it's not that hard to extract them. And so this platform basically puts together all the questions, like questionnaires, the surveys do that are doing mostly each year. So it's very easy to replicate this. We in the I hope in the future they upload the 2023 data, so we can still make a new picture to see how it's doing this new plan.
Okay, this is here the value is having determined the four most important elements that really factor for the anemia. I think this is an example that a relatively simple, model can really have a tremendous impact on improving the health or allowing early intervention to decrease the anemia in Peru. Very good job. Thank you.
Thank you for your words.